Thank you all for coming. This is just an important but symbolic act. So I believe that with the permission of the partners, allow me to say, and I think that I represent the feelings of most of the people, if not all the people in this room, to give our thanks for all who contributed to the organization, and above all to all of you for your contributions, your insights, and your good humor over the last 2 days. And it's not only been for me a really illuminating and at times moving experience to be here. Now we know much more clearly what needs to be done to put into practice all those good intentions and well-researched proposals. And we know where we're going to do it, with whom we're going to do it, and we're very much looking forward to Malta 2017. Thank you so much for your support, Prime Minister. Thank you.
So, and maybe you want to add something?
Well, I will pretend that was not planned. No, I just wanted simply to say very much thank you to you all, because I'm really impressed. If I compare, as I said, today and 5 years ago, you know, the quality, the data, the information, I felt was really marvelous. And I can tell you that my pride is such that, you know, taking this wonderful opportunity, I would say Norbert and the Ethic Board, I would say as of probably tomorrow morning, we will start thinking about how to bridge this event with the next one to ensure that in this 1 year, we are going to have so many exciting new successful experiences that 17 is going to be even more successful than this year. So thank you very much to you all, and looking forward to meeting you again next time. Thank you.
Thank you. And to give it a final conclusion, everything was said. Let's listen to some statements we got. And on this note, I would like to thank you particularly for your patience, because I was bothering you with a microphone and a camera the last 2 days. Thank you very much. But it's all for the good sake of SIB and for your good statements, your good thoughts. Thank you very much for this. And let's watch some of the statements for the final closing.
Well, the assessment of pain is important because pain should be recognized as being the 5th vital sign of patients. And that means that pain should be assessed on a daily basis in each and every patient that comes to the hospital, either for hospitalization, either for ambulatory care. And in that perspective, assessment of pain is also an essential part of the accreditation of hospital, because if you provide regular assessment of pain and high quality of pain treatment, that's really an important quality issue for hospitals.
For me, the most important item just now to focus on is quality indicators, because if you have good quality indicators, you can compare and you can make pain visible. Just now we have the difficulty that pain is an individual problem. It's very subjective. And to work on it and even to make it visible for our stakeholders, for healthcare professionals, for health insurances, and even for the politicians, for the member of the European Parliament, we need numbers. And to create those numbers, we need quality indicators which are able to compare the quality of treatment all over Europe.
Okay.
There is enormous pressure on us to do something about patients who live with chronic pain because it has an enormous impact on society. We recognise, of course, that there is a problem with an impact on the patient, but we often don't look further than that. And we now know that there is an enormous economic impact, but also there is an impact across our general practice, where many, indeed often most of the consultations involve discussion of long-term pain, and in our secondary care services. So a huge impact on the patient, their family, their employers, and on society at large. So I'm hoping that the EU will recognise pain as a condition in its own right, a long-term condition, and that then there will be policies supporting implementation and delivery of services for those who live with that pain.
It's very important to involve general practitioners in the care and the treatment of chronic pain patients, because the GP knows the patient for a long time, and most of these patients go to the general practitioner. But it's also important to improve the collaboration between general practitioners and pain specialists.
The main message I would like policymakers to take home from this meeting is that they should facilitate access to opioids in Europe, because it's still inadequate in many countries and patients are suffering needlessly.
Well, the priority in addressing societal impact of pain will depend also on the type of pain. My expertise in cancer is in cancer pain. And you know that cancer pain is one of the most feared symptoms in people affected by cancer, and it affects their quality of life in different ways. Cancer can be a curable disease, and still pain is a significant symptom during the treatment and after cure. But cancer pain can be a very important aspect of the quality of life of patients who are not being able to be cured of their cancer. So it is characterizing the advanced and the terminal phases of their disease in more than 80% of the cases who are not going to be cured. So in Europe, we can figure out that in 2016, we will have about 1,200,000 at least, 1,300,000 perhaps, people dying of cancer, experiencing pain. And I think this is a very big impact for our society to take care of this pain in the best way we can.
I think all politicians should be very interested, because it affects many people and is very important for the healthcare system. We need activities on the national basis so that these can interact with the European level as well.
So, and I think, Chris, you wanted to say something? But before, I would like to ask you, will we see us in Malta next year? What do you say? You will be there? Absolutely? Super. You're sure? Definitely. These are the right answers. Thank you very much.
This is just very quick. I know we all want to go home. It's been a hard 2 days, but it's been worthwhile. Speaking up for the European Pain Federation, EFIC, I really sincerely want to thank everybody who's attended for all the input you put in. We're especially grateful for the MEPs. And you know, when we went to see the MEPs to ask them to help, it was pushing on an open door, because most of them knew someone who had pain. Some of them even had pain themselves, and we just heard that from Mr. Sant. So especially, this is a wonderful invitation from MEP Sant to go to Malta. We're very excited. We've had the official invitation. We thought we might get one, so we are already working behind the scenes. Thank you very much to our partners as well. Safe journey home. Thank you very much.
Thank you. And thank you. And bye-bye. This was the ZIP 2016. See you in 2017. Thank you and bye-bye.